Hi, good evening, everyone. We'll just wait for a few more minutes to see if others are joining, or else we can start. Good evening, everyone. Am I audible?
Yes, ma'am.
Yeah, thanks. I guess we can start. Let me just share my screen. Yeah, good evening, everyone. Welcome back to session 9 of the NPTEL online course Drug Delivery Principles in Engineering. As you all know, we have been discussing some previous year assignments in an attempt to let you know what type of questions you'll be facing in the exam at the end of the course. So let's begin with our discussion today. As you must have gone through the week 9 lectures. If not, we'll go through some of the concepts which have been discussed in this week. So for the past few lectures, we have been looking at different routes of drug delivery, and we have discussed several advantages and disadvantages of oral route, parenteral, which included subcutaneous, intramuscular, then transdermal, intraarticular and intravenous inhalation route, etc. Next, moving on, we have in this lecture further was discussed about immune response to materials. Since it's a drug delivery course, we have also looked at how you can deliver biomaterials to a patient in an attempt to relieve him of the disease condition. So in that case, since you're implanting something or injecting something in the body which can be considered as a foreign material by the body, it is definitely going to generate some immune response. And there are two types of immunities which a human body has, that is innate and adaptive immunity. So some basics about that has also been discussed, of how innate immunity is non-specific and which immediately comes into play whenever something foreign is detected in the body. On the other hand, adaptive immunity is very highly specific to whatever antigen you are introducing, and which has a late onset, which takes over after innate immunity has been completed, and then it lasts for a longer duration wherein you have your memory cells coming into play. Next, important concept while discussing about drug delivery and delivering biomaterials is inflammation, because as I said, since it's a foreign material, it's going to have some immune reaction, and this happens sequentially. So first of all, your body is going to detect the foreign entity, it is going to activate, this leads to activation of immune cells such as macrophages or dendritic cells, and they further release cytokines. We'll look at what cytokines are in a couple of minutes. And because of these cytokines, so these are smaller proteins which then cause the influx of leukocytes, which are your T and B cells, and then they take over the infection. If there is a bacterial infection, they'll kill those cells. If there is a foreign entity, they'll try healing it on their own, and that's how this inflammation proceeds. Next important concept that was discussed is complement system, which are smaller proteins which keep floating in your bloodstream, and they are mostly used to clear microorganisms. So whenever they detect any bacteria, any virus, they come into play, and then they generate an immune response, and they help the innate and adaptive immunity to clear off these microorganisms. So why are we learning about immunology in this courses? Because since this course is drug delivery, we have to look at some of the immunology concepts, because as I said, whenever you implant some material into the patient's body, it is definitely going to have a immune response, and that's where this becomes important. Because for example, if you, let's say you have injected some nanoparticle which might be a PLJ microparticle or a nanoparticle, and which inside that you have your drug, and now you have injected this into the patient's body, and you are expecting the drug to be released over a period of time and then relieve the disease condition. But in case so your blood also, apart from complement system, your blood is also going to have certain blood clotting proteins, and since you have injected something foreign, they think that there is a problem with your immunity, and they will start clotting around this nanoparticle which you have injected. So they don't know that this is for the treatment of the disease. So they'll start forming a clot around your nanoparticle, and in this way they'll block the release of that drug. So if this happens, then you might this might lead to a failure of the treatment, and it might also lead to certain severe immune reaction, which then wherein you have to clear that whatever implant you have injected to not let it get any further. So this was also discussed, and then we'll also discussed about some of the ways of how you can reduce this immune reaction. Apart from that, towards the end of the course, end of this week lectures, we have looked at adaptive immunity in a bit detail, which includes dendritic cells. So dendritic cells and macrophages are kind of a link in between innate and adaptive immunity. And so whenever there is a foreign particle detected, macrophages will engulf it, they will phagocytose it, and they will present it on their cell membrane. You guys must have read about immunology a bit. So these are known as antigen presenting cells. They will present these antigens to T cells and B cells, which will then further, so T cells will directly attack the microorganisms while B cells produce antibodies against these antigens, and that's how they help us have a very good defense against these foreign particles. So adaptive immunity becomes important when you want to design vaccines. So that has been covered in this week, and the next week will again be looking at some of the vaccine, how we can design a vaccine. So these all concepts were cleared. So having this basics, we can then go ahead with the assignment 9. Does anybody have doubt in these concepts or in the lectures which you must have attended to? If not, then I'll proceed with the assignment questions. Anybody has any doubt? Okay, I don't see. Am I audible? You guys can hear me, right?
Yes, ma'am.
Okay, yeah, sure. So we'll move on towards the assignment then. So the first question is, which of the following options represent the correct chronology of events in inflammation? Have you guys, if you have read this, then you will be able to answer it. If not, you guys can give it a guess. If anybody has any response.
Third option.
Sorry?
Third, vasodilation, edema, clearance.
Okay, third option. Okay.
Sorry, fourth one. Influx of leukocytes, vasodilation, edema.
Okay, sure.
Fourth one.
Okay, fourth option. Anybody else has a response? We'll look at the answer in a couple of minutes.
One.
First one, did somebody say first?
Yes.
Okay. Thanks for answering. Anybody else? So we have two answers, first and fourth.
Maybe first or second, madam.
First or second. Okay, you're getting a bit confused, I see. We'll see. Thanks for answering. No other responses? Okay, then let's look at the answer. So the correct answer is the chronology of events is first there'll be vasodilation, there'll be edema, influx of leukocytes, clearance, and then healing. So the right option is first option. So this is how inflammation proceeds. So this is one of the slides I picked up from the lectures which the professor has given. So whenever you have a tissue injury or you have some foreign particles detected in the body, first of all they're going to activate the macrophages, because macrophages are big cells. They phagocytose these particles, and because of this phagocytosis they'll release something known as cytokines. Now these cytokines, even though they are very smaller in size, there are a number of cytokines present. They lead to they trigger this cascade of events. So first what happens is it will cause vasodilation, which is nothing but increase in diameter of the capillaries. So your capillaries will increase in size a bit to let lot of blood flow in towards the site of injury or wherever the infection is detected. So this in turn brings in a lot of your immune cells, the leukocytes. So that is why we observe redness whenever we have some injury. Next, after vasodilation, it will also increase the capillary permeability. This will again bring in a lot of protein-rich fluid and cells. That leads to edema, which is nothing but swelling and pain at the site of injury, because a lot of cells, lot of fluid is flowing in a very smaller area. That is why you can see swelling and you feel pain after an injury. So first of all, there will be vasodilation, there will be increase in capillary permeability, and then a lot of leukocytes will flow in. These are your B cells and T cells or your dendritic cells, and then they take over the healing and tissue regeneration. So first of all, there'll be clearance of the foreign material, and then healing and tissue regeneration will occur, which is nothing but formation of new capillaries and a scar tissue, which we see after the injury has healed. So the right sequence is vasodilation, edema, then your leukocytes will flow in, they'll clear whatever foreign particle is detected, and then they'll start the healing. So is this clear? Is this making sense? Let me know whenever you guys have a doubt, or if something is not clear, we can go over it again. If not, I'll move on towards the next question. Okay, so the next question is, the three arms of complement cascade converge at a protein complex known as? Any guesses? Does anybody know the answer?
Option 2.
Option 2, that is C3 convertase. Okay, thanks for answering. Anybody else?
Option 2, ma'am.
Option 2, okay. Anybody else has another response? Okay, so let's look at the answer, and both of you are correct. The right answer is C3 convertase. So let's see. So as I said, complement system refers to a series of proteins which are smaller in size, somewhere around 10 to 200 kDa, and they're always circulating in the blood and surrounding the tissues. So the proteins are always in an inactive form to not let a hyperimmune reaction occurring in case there is no infection. But whenever they recognize a foreign material or a microorganism, they will become active and they will trigger the cascade of events, which is they will start an influx of leukocytes at the site of injury or wherever they detect the microorganism. So complement system gets activated by three different pathways. First is classical pathway, alternate pathway, and lectin mediated pathway. So all of these pathways, they might start in a different way, detecting different molecules. For example, classical pathway starts when they detect antibody. This is an antibody mediated pathway. So they get triggered whenever they detect antibody molecules in the body. For example, if you have a microorganism, there's a bacterial infection, so these bacteria will have, so antibodies will quickly recognize the antigens on this bacteria as foreign, and they'll just surround this bacteria. So there's your bacteria and you have your antibody molecules surrounding it. So this complex is detected by these complement proteins, and that's how they get activated. On the other hand, alternative pathway gets activated when you have some biomaterial in your body. For example, you have your titanium rod implanted into a patient, so that surface will trigger the activation of these complement systems. Third pathway is the lectin mediated pathway. They will directly recognize some components, some antigens on the microorganism itself. So no matter how these complement proteins are getting activated, they will always come to a common point, that is C3 convertase. So all of them will ultimately activate this C3 convertase, and then the complement system will further follow. So the right answer for this question, the three arms of complement cascade converge at a protein complex which is known as C3 convertase. Any doubts in this? If not, we can move on. Okay, the third question is, which of the following approaches can be employed to reduce complement activation on a biomaterial surface? You have to mark two correct options. Let me know if you guys know the answer.
Option 2 and 5.
Okay, option 2 is reduce surface nucleophiles, and 5 is 1, 2, 3, 4, 5. Heparin adsorption to the surface. Okay, thanks for answering. Anybody else wants to give it a try? I'll let others read the options as well. Okay, no one else? Let's discuss the answer then. So yeah, you were correct. The right option is reduce surface nucleophiles, and heparin adsorption to the surface can help. So as I said, this complement proteins, since they're always floating into your body, whenever they detect this biomaterial surface which you have implanted, they consider it as foreign and they get activated. So once they get activated, they will cause a very high immune reaction, and that will lead to your biomaterial failure. You have to remove that implant in case it's causing a lot of problem to the patient. So to avoid this, there are certain ways which can reduce this complement activation. One of that is to reduce the surface nucleophiles. So if you look at this image, this is your implanted surface. Let's say this is the implant surface, and if it has certain nucleophiles attached to it, nucleophiles are nothing but negatively charged species which are electron rich. So your C3b, which is one of the proteins in that complement pathway, it has very high affinity to negatively charged species, that is a nucleophile. So whenever it detects something like that on a membrane or a surface, it will immediately bind to it, and then it will start triggering the C5a, which then further the cascade will follow, wherein they'll start recruiting neutrophils and monocytes, which can cause an immune reaction, which will further lead to certain problems such as respiratory distress, or in extreme cases it can even cause a heart attack. So to avoid this, what you can do is you can make your surface less nucleophilic, meaning you can remove these negative charges and try making the surface neutral, so that it will reduce the interaction of C3b with the biomaterial. Another option is you can try reducing the activation of the C5a. C5a is one of the proteins in this complement pathway, which is responsible for inflammation and other reactions, which are some of these reactions are listed here. So what you can do is, since you have already implanted this biomaterial, what you can do, you can try sequestering the C5a to some other surface, meaning you can collect all this C5a that is roaming around in the body and keep it bound to some other surface, so that it's not free to activate the other proteins. So in this way you can try reducing the reactions of C5a. Another method is there is heparin adsorption to the membrane. What you can do is you can adsorbed heparin on the surface, which will lead to inactivation of C3 convertase. So as I said in the previous question, we discussed what C3 convertase is. That is one of the proteins which leads to further activation of other proteins. So what you can do, you can adsorb heparin to the membrane, whatever surface you have implanted, and this will lead to inactivation of C3 convertase. So these are few of the ways where you can reduce this complement activation. So two of these options are listed in this question. One is reduce surface nucleophiles and heparin adsorption to the surface. So I hope this is clear.
Madam.
Yeah, thank you. If this is clear, then let's move on towards the next question. Next is, which of the following factors can cleave fibrin in vivo? Anybody has the answer?
Option 4.
Option 4, that is plasmin. Okay, thanks. Anybody else?
Yes, ma'am. Option 4, plasmin.
Okay, thank you. Others have a different answer? Okay, no other response? Yeah, both of you are correct. The right answer is plasmin. So fibrin is something that is involved in blood clot formation. So this is one of the images. So these are very few proteins which are listed here which actually take part in a clot formation. So whenever there is a capillary injury, for example, whenever you you inject an implant, some of the capillaries nearby that implant might get ruptured, and this triggers the blood clotting cascade. So several proteins such as prothrombin or thrombin, they activate this clot formation. So this is, for example, let's imagine this is your clot which is forming on an artificial surface because it considers that this is the injury, this is where the blood capillaries are getting severed. So whenever this clot forms so this is the normal response your body will have to an injury. Whenever the capillary is broken, the blood clots, platelets will, this prothrombin will activate thrombin and it will recruit platelets and they will form a clot there. So this is to prevent an excessive loss of blood. After a while, whenever after this clot formation, your tissue will also start regenerating. So that's the scar tissue which we see after an injury. So after your tissue has completely regenerated and it has healed, this clot formation has to go away. Otherwise, it will keep on blocking the capillaries, which we don't want. So in a normal immune reaction, after the tissue has healed, the clot formation has to dissolve. So to break this clot, there is something known as plasmin. Plasmin is another protein which gets activated after plasminogen, which is released by some of the tissues. So this plasmin acts on this fibrin molecules which are present in this blood clot, and they will break open this fibrin. Fibrin is nothing but long fibers which make this clot, and plasmin will act on this fibrin. They will dissolve this clot, and then the clot can be removed from the body. So the right answer for this question is plasmin is one of the factors which cleaves fibrin inside the body. Clear? If no doubt in this, I'll move on towards the next question. Next question is, pick the incorrect statement regarding cytokines and you have to choose two options. I'll let you guys read through the options carefully and then let me know when you're ready to answer.
Option 1 and 6.
Option 1, okay, cytokines are small lipid molecules, and option 6 is okay, the last option. In their active form are pure peptide chains without sugar lipid moieties. Okay, anybody else? Thanks for answering. Okay, no other response. Let's look at the answer. Whoever answered, you're correct. The correct option is first and last. So we'll look at what cytokines are, and then we'll come back to this question and look at each and every option. So cytokines, as I said, are small proteins which are released by various cells in the body, usually in response to an activating stimulus, and these induce induce responses through binding to specific receptors. So whenever they detect something like a microorganism, they will trigger they will cause your macrophages and your dendritic cells to be activated. So if you look at the options one by one, so cytokines are small lipid molecules that are released by various cells in the body, usually in response to an activating stimulus, which is wrong because these are not lipid molecules, they are protein in nature. Next option is cytokines can act in an autocrine manner so that it affects the same cell type that releases the cytokines. For example, let's suppose there is a macrophage and it has engulfed a microorganism and it starts releasing cytokines. So sometimes these cytokines can have receptors on the same macrophage cell as well. So they can start activating the same cell that has released the cytokine. So this is known as an autocrine manner of activation. So yeah, cytokines are able to do that. So this is also correct option. Next, cytokines can act in a paracrine manner, so that cytokines can affect the behavior of adjacent cells. So in the same example, this macrophages has released the cytokines and now they are acting on a nearby cell which might have different receptors compared to the first cell. So this is known as paracrine manner, whenever a macrophage releases these cytokines and they affect nearby cells. So this is known as paracrine. So this is also correct option. Next is some cytokines have enhanced bioactivity when conjugated to molecules like polyethylene glycol, because polyethylene glycol might have some immune reaction, some antigenicity. So some cytokines can actually get more enhanced after conjugating, after being conjugated to molecules like PEG. That is also correct option. Next is cytokines are highly potent proteins that bind to their cognate receptors and induce downstream signaling cascades in respective cells. This is actually the function of cytokines, so that's also correct option. The last is cytokines in their active form are always pure peptide chains without sugar or lipid moieties, is a false option. These are not actually peptide in nature, they are very small proteins, somewhere around 25 kilodalton. So the first and the last option is incorrect. Every other information listed here is the right information about cytokines. Any doubts in this? If not, I'll move on.
Ma'am, if it is that regarding the last option,
Yeah. Oh, sorry.
means definitely that will be linked with the number of amino acids, then it is a peptide bond.
Yes, so there is a clear, I mean, yeah, this might be a little vague of what exactly is a protein and what exactly is a peptide. So peptides are usually they will have somewhere around, let's say, 20 to 30 amino acids linked together. Proteins are usually
Yes.
larger than peptide chains. So if you have a protein which is of a 25 kilodalton molecular weight, which is actually a big protein compared to a peptide. But if you compare that with an antibody which is somewhere around 150 kilodalton, in that respect cytokines are small proteins. Is this making sense?
Yes, yes.
Yeah.
But
Yes. Go ahead. Hello. Do you have another doubt? I guess no. If you have further doubts, we can discuss later on. I think you're not audible, so I'll just move on. The next question is, inflammation facilitates the onset of extravasation, and we have to select two correct options regarding this process of extravasation. So if I'll give you guys some time to read through the options. After that, you can let me know if you have the answer. Anybody?
Option 5 and 6.
5 and
Last
6.
option.
Last two options. Okay. Okay. Anybody else?
yes, option 5 and 6, ma'am.
Okay. Thank you. Others? No more responses, then we can discuss this in detail. So the right option is, both of you are correct. The right option is the last two options, but there's another option that is also correct, but it's not given correct in the assignments which we have solved, but that is also one of the parameters of onset of extravasation. So extravasation is nothing but it's the process when your immune cells, most preferably your neutrophils, cross this endothelial layer. Just a minute, I'll start the pointer. So this is, just imagine this is your blood flowing. This is the endothelial layer, which is the lining of your blood vessels, and this is where your tissue is. So whenever there is an injury in the tissue, whenever the immune cells have to migrate, since they're floating, roaming around in this bloodstream, they have to be recruited towards this tissue to carry out their function. So the process of your immune cells being transferred from this blood flow through this membrane at the site of injury is known as extravasation. So as you must be knowing, this endothelial layer is a very tight layer, so there is no gap in between these individual endothelial cells. This is to prevent things leaking out from the tissue into the blood and vice versa. But now your immune cells have to go through this endothelial layer to reach this tissue where the injury is. So this process is known as extravasation, and this is usually followed by the inflammation. So whenever there is an inflammation, as I said, your cytokines will call upon all the immune cells. They are literally signals which will be like, this is where the injury in the body has happened and you guys have to come here. So before that, first of all, now let's take this example of this neutrophil. It has to cross this endothelial layer. For this to happen, the blood flow has to be first of all decreased. Since if the blood keeps on moving at a very fast rate, your cells will not be able to interact with this membrane cells, and they won't be able to pass here. So that's why first of all your blood flow decreases. After that, your something known as rolling adhesion occurs. This is known as a rolling adhesion model, where as you can see, there are few membrane this protrusions coming out of your neutrophils. So these are nothing but molecules which can interact with the molecules, this pink molecules here, which are present on your endothelial cells. So for that to occur, there is something known as rolling adhesion model. So this neutrophil will literally keep on rolling on this, it will go and round rolling on this membrane, and that's how it interacts with the molecules on this membrane layer. After that interaction happens, then your neutrophils will literally squeeze in through the gap that occurs in between these two endothelial cells. So this gap can be created by something known as MMPs, which are sorry, I forgot the name. I think it's metalloproteinases, membrane or something metalloproteinases. They will cleave this membrane here, and they will create a gap in between these two cells for your neutrophils to pass in. So this entire process is known as extravasation. After passing through this layer, then your neutrophils can reach this site of injury, and then they can take care of the bacterial or viral infection that is present there. So this is the extravasation process. So the question is asking us, we have to select two correct options which occur in the parameters which occur in this extravasation. So first right option is, during the process the velocity of blood flow decreases, which then allows the cells to interact with the endothelia, and then it involves the process of migration of neutrophils through the endothelial layer, as I just mentioned. Also, the one other phenomenon that occurs is extravasation follows upregulation of adhesion molecules on endothelial cells, followed by the release of chemotactic factors. So adhesion molecules are nothing but these ICAM. One of the molecule is known as ICAM. So these are necessary to interact with the neutrophil molecules. So something like that also happens, which is known as upregulation of adhesion molecules. So that is also one parameter of extravasation. So I hope this process was clear. I might have ran through it a bit fast. Anybody has any doubts in this? If you consider all other options, they are not correct. They are not the right information about extravasation. Do you guys have any doubts here? No? If not, then I'll move towards the next question. The next question is, what is the role of platelets during blood clotting? Again, two correct options. cases?
First and third option, ma'am.
First is stimulate the clotting of blood and wound healing and release variety of chemical mediators that promote clotting and healing of damaged tissue. Okay, thanks for answering. Anybody else?
1 and 3.
Sorry, you were not clear. Can you please repeat?
3.
Option 3. Okay.
1 and
Okay. Yeah. Anyone else? Okay, no more responses. Yeah, both of you are correct. The right option is 1 and 3. So as I mentioned, platelets are cells which come into play when there is blood clotting to happen. So these are some of the roles of platelets. First is they react with the extracellular matrix proteins when blood vessels are severed or there is an injury, or they can also react with biomaterial surface. That is why it's important to know this phenomenon. And then they release a variety of chemical mediators from their granules. So platelets are very granular in nature. They'll release these chemotactic molecules and they will further recruit more platelets to form this clot, and they stimulate coagulation and wound healing. Rest of the options are incorrect about platelets, so the only right options are they stimulate clotting of blood and wound healing, and they release a variety of chemical mediators that promote clotting and healing of damaged tissue. Clear? If no doubts, then I'll move on towards the next question. Next is, we wish to generate an osteoconductive implant by coating it with fibronectin. For this purpose, an aqueous solution of fibronectin was prepared. Assuming the surface of the implant is positively charged, how should we change the pH of this solution so that large amount of fibronectin is still attached to the surface, and we have been given PI of fibronectin. So, simple question, we have a surface, we want fibronectin to be attached to it at a large amount, and this is implanted into the patient's body. So the question is asking us what should be the pH of the solution be so that most amount of fibronectin is still attached to the surface after implantation. Any answers?
option 2.
Option 2, that is make pH higher than 5.75 at 37 degrees Celsius. Okay, anybody else? Others?
Maybe option 2, ma'am.
Okay, thanks
Because
for answering.
37 degrees Celsius, that is the normal body temperature.
Yeah, that makes sense.
And I think so, that may be.
Okay. Any explanation for the pH? Why should the pH be above 5.75? The first one who
I
answered,
think-
would you like to? Yeah, go ahead. Yes, go ahead. You were saying something.
When you are making the pH above 5 point greater than 5.75,
Right.
and also the attachment to the surface may be more.
Okay, yeah, that's what we are looking for. I'm just asking if you know the reason of why it will be more. It's okay, we'll discuss. So both of you are correct. The right answer is option 2, that is you make the pH higher than 5.75 at 37 degrees Celsius. So about the temperature part, it's clear. Whoever answered second has explained it, because since you are injecting it into the body, at the body temperature is at 37, so at 37 degrees Celsius you want more fibronectin to be attached to the surface. Now let's look at the pH thing. So since the surface is positively charged, for more fibronectin to be attached, definitely fibronectin has to be negatively charged, so that electrostatic interaction happens there. And since pi of, that is the isoelectric point of fibronectin, is 5.75, if your pH is more than your pi, then fibronectin will be negatively charged. So that's why if you have pH higher than 5.75, that's when the fibronectin will be negatively charged. More of it's in a dissociated form. It's like an ionic form, and H plus has been dissociated from it, deprotonated. That's why it will be negatively charged. So the right option is you make the pH higher than the pi at 37 degrees Celsius. That's when the interaction of fibronectin to the surface will be the strongest. Is it clear? Did you guys get this?
Yes, ma'am.
Yeah. Thank you. Okay, then moving ahead. The next question is, which of the following is not a physiological event occurring during inflammation? And we have to select two correct options. So which of these do not occur when an inflammation occurs? Any guesses?
Option 5 and 8. Last one.
Okay, 5 is 1, 2, 3, 4, 5. Reduction in temperature, and last one, migration of immune cells away. Okay.
Madam. Yes, madam. Reduction in temperature at the site of inflammation,
Yes.
and migration of immune cells away from the site of inflammation. Actually,
Right.
during inflammation, there is a migration of immune cells where the inflammation will take place.
Right,
And
right.
also during inflammation, there is an increase in temperature. Whereas
Yes.
they are given reduction.
Right. So
Correct.
both of you are correct. The right option is reduction in temperature and migration of immune cells away, because these two events definitely do not occur. What occurs in inflammation, as we saw a few minutes back, is first of all, let's look at the options one by one. Vasodilation will occur because most of your cells have to flow towards the site of inflammation. That's why your diameter of the capillaries increases. Then there is increase in capillary permeability, which will then bring in influx of protein rich fluid. All the three options are correct. There is definite swelling because of a lot of cells flowing in, that is known as edema. The fifth option is reduction in temperature at the site of inflammation, which is wrong, because whenever there is an inflammation, you will see that at the site of inflammation the temperature actually increases. This is also what happens whenever you have a viral infection. That's why we get fever. The next option is pain at the site of inflammation. This is again happens because of a lot of cells flowing in. An influx of leukocytes and phagocytic cells into the tissue, which is the hallmark of inflammation. That is why inflammation occurs, so that it can bring in a lot of your T and B lymphocytes to tackle the infection. And the last is migration of immune cells away from the site of inflammation, which is again wrong, because as somebody explained, immune cells flow in at the site of inflammation. I'm sorry, I can't see the names, whoever is responding. So yeah, is this clear?
Yes, ma'am.
Yeah, thank you. Then we'll move on towards the last question of this session. The last question is, which of the following is not an action of the complement system? And you have to choose two correct options. Any answers?
Option 2 and 6.
Option 2 is repel infiltrating leukocytes, and 6 is 1, 2, 3, 4, 5. Protect foreign objects or organism from degradation. Okay, thanks for answering. Anybody else? Okay, no one? Yeah, you were correct. These two options are the right option, because everything else is actually an activity of complement system. So these are some of the functions of the complement system. They trigger inflammation, they chemotactically attract phagocytes to the infection or injury site, they promote the attachment of antigens to phagocytes, which is also known as opsonization. Then they cause lysis of gram-negative bacteria and human cells displaying foreign epitopes, and they also remove harmful immune complexes from the body. So both these options, that is repel infiltrating leukocytes from the site of infection or inflammation, is wrong. They actually call upon these leukocytes, and they protect foreign objects or organism from degradation is also wrong. They actually cause degradation of foreign these microorganisms. So that's all. We have covered all the 10 questions. So if anybody wants me to repeat some of those questions, you can ask me to, I'll explain it further. Or if you guys have any other doubt, we can discuss that.
Ma'am, can you please go through question number 1?
Okay, yeah, sure. Question 1, is it?
Yes, ma'am.
Thank you.
Thank you. Yeah, so the question others can drop out of the meeting if you don't have anything else to discuss, or else this will be just a repetition for you. So the first question was, which of the following options represent the correct chronology of events in inflammation? So whenever inflammation occurs, there is a certain cascade of events that happens one by one. First is there's vasodilation, meaning your capillaries will grow up a bit and increase in diameter to let blood flow towards the site of inflammation, which causes the redness. Then there is edema. Edema is nothing but increase in the capillary permeability. Along with diameter, its permeability will also increase. This will bring in a lot of protein-rich fluid and cells, which are your immune cells, your leukocytes, and this actually causes swelling and pain, which is known as edema. Then there is influx of leukocytes, as I said, because they have to clear off this infection. Then there will be clearance. They will clear off this bacterial or viral or whatever microorganism, foreign particle is there, and then afterwards healing will occur. So there is this is how the inflammation occurs. First is vasodilation, edema, influx of leukocytes, clearance, and healing. So that's the correct option. Did you get this?
Yes, ma'am.
Yeah. Anybody else has any doubt?
Ma'am, question number 4. Can you repeat?
Yeah, sure. Just a minute. 2, 3, 4. 4 is this. Which of the following factors can cleave fibrin in vivo? The right option is plasmin. So fibrin is one of the components in a blood clot. So whenever there is an injury or you have an artificial surface implanted into the body, blood clot formation occurs because the body thinks that it's undergoing some injury, so it will stop. So whenever you implant something, there is a chance that, so let's say you have implanted a titanium rod, and there's a chance that while implanting you have cut down some very smaller capillaries have been cut down, so that's where the blood will flow. So the body will try stopping this blood flow and it will make a clot there. So whenever a clot forms, you have to also clear this clot. So your body has a natural mechanism to dissolve clots after the injury has healed. So there is something known as plasmin. It is a protein flowing in the body which gets activated after plasminogen. So this plasmin will act upon the fibrin. It will break down fibrin. It will dissolve these fibrin layers, these fibers, and then that's how the clot gets dissolved. So the question was, which of the following factors can cleave fibrin in vivo? The answer is plasmin. Clear?
Yes, ma'am. Thank you.
Welcome. Others?
Thank you, ma'am.
Thank you. If nobody has any doubts, then we can stop this meeting and I can meet you guys in the next week for session 10.
Ma'am, can you repeat question number 5, please?
Question 5. Okay, I just stopped the presentation. I'll just share it again. Give me a minute. Question 5. Just this. Okay, the question is, pick the incorrect statement regarding cytokines, and 2 of these options are incorrect. So the right options are these. So cytokines are nothing but smaller proteins which are responsible for activating your immune cells. So whenever, let's say, there's an infection in the body, there's a microorganism floating around, your immune cells, which are your macrophages, will engulf this microorganism, and in a response they will release these cytokines. Cytokines are then able to affect other cells, or it can affect the same cell that has released these cytokines, and they will further mount a higher immune response, and they'll call upon rest of the lymphocytes to clear away this infection. So if you look at these options, first of all, cytokines are small lipid molecules is wrong, because it's not a lipid molecule, it's protein in nature. So that is one option for this answer. And then cytokines in their active forms are always pure peptide chains without sugar or lipid moieties is also wrong. It's not a peptide, it's a complete protein. Peptides are smaller in nature. For example, it can have 20 to 50 amino acids, but proteins are a bit higher in amino acids compared to your peptides. The rest of the options are all correct. Cytokines do act in an autocrine manner, meaning they will affect the same cell that has released it. Cytokines can act in a paracrine manner, meaning if there is a macrophage that is releasing cytokines, these cytokines can go and affect nearby cells. That is known as paracrine manner. That is also correct. Some cytokines can have enhanced bioactivity when conjugated to molecules like PEG. That is also correct. And cytokines are highly potent proteins that bind to their cognate receptors and induce downstream signaling cascades in the respective cells, which is also correct. So the only wrong options are first and last. Clear?
Thank you, ma'am. Please.
Yeah. Welcome. Others have any doubts? Or I'll stop, then I can stop this meeting. Okay then, bye-bye. See you guys later. Thank you.